Good morning.
Hi.
I'm Dr. Gallagher.
Hi, I'm
This
Michelle.
This is my medical assistant, Kim.
Hello.
It's nice to meet you this
Nice to
morning.
meet
Why don't you tell me in your own words what your chief complaint is? Why are you here today?
Well, I'm here today because I've had 4 children,
Okay.
and it started after my second varicose veins in my legs. So they're painful and kind of ugly. So I want to be able to wear shorts and not feel so much discomfort at the end of the day. So I figured I'd come in and see what my options were.
Very good. Is it both legs that bother you? Does one leg bother you more than the other?
The left bothers me more than the right. They bulge more on the left than they do on the right.
Okay.
But I have some spider veins on the right that after a long day they start to throb.
They can hurt as well.
Yes.
Yeah, it's pretty well known that spider veins can be painful as well as unsightly. Okay, so what I'd like you to do is just stand up if you don't mind and come over here. And I want to just have you face me. And we're going to start with your right leg first. I'd like you to put your right leg on this. And just hold these lovely shorts up there. And I can see where are most of the spider veins that bother you. Things like this.
Yes.
This is a very common area. It's called the vein of Albanese area. It's the most common area that women who've had children have spider and reticular veins. Okay. It doesn't appear that you have any large bulging varicose veins on this leg. So you have unsightly symptomatic spider and reticular veins in your right leg. Is that a fair statement?
Yes.
Okay. So I could tell already from looking at your leg while you were sitting down that your left leg is much worse. So we're going to switch now. You're going to stand over here and face me and put your left leg out and just keep the weight on the right and just rotate the leg. So you have, just relax the leg, relax the leg. You have obvious bulging veins, okay, in this area here.
Yes.
Okay. A lot of times when you have big bulging veins like that, it's because a vein underneath called the great saphenous vein is incompetent, and I'm going to explain what that is in a couple of minutes. But what I want to do is take a look with the ultrasound machine at that vein to see if I'm correct. So right there, as you can see, Kim is going to point out that's your great saphenous vein. Now we're going to go to color. Now, if you notice, when I squeeze, there's red and blue color, and when I let go, it persists. That persistence of the red and blue color indicates that the valves in this vein are not working correctly. I'm going to explain what that means in a minute, but it pretty much confirms my suspicion. So what I'd like you to do now is just come over here. We have that, come right over here, and I'd like you to sit up here and just dangle your feet if you can. This leg over here, Kim is going to turn the light out. If you can see that you have these large bulging veins, okay?
Yes.
The definition of a varicose vein is a vein that's at least 3 millimeters in diameter and kind of sticks out on your leg like a rope, okay? And you have obvious large bulging varicose veins. Now, with respect to spider and reticular veins, let me just show you what this looks like. These are much smaller, obviously, okay? So you can see it almost looks like you have like a little bush or branches of a tree and then a tree trunk. So it's really a complex. It's called the reticular spider vein complex. So the treatment for this, I think you had mentioned on the form that you've tried to use compression therapy to treat this, and it really hasn't helped much.
It has not.
So with respect to what's going on in your left leg, there's no question that there's a simple, minimally invasive operative procedure that we should consider doing to treat that. With respect to the spider veins in your right leg, that's treated with a procedure called sclerotherapy. Everything you need done on the left leg is usually covered by insurance. Sclerotherapy is considered by the insurance companies to be cosmetic, even though we know that the spider and reticular veins can cause pain and be unsightly. It's still considered a cosmetic procedure. So let me just tell you how this happened. Okay? As the arteries bring the blood to the legs and the veins take the blood back to the heart. The way the blood gets back to the heart is when you walk, your calf muscle squeezes the vein and sends the blood up to your heart. But gravity wants the blood to come down, so you have valves in your veins. So when things work right, the calf muscle squeezes, the valve opens, the blood goes up toward your heart, tries to come down, and the valve closes. That's the way the blood gets back to the heart.
Okay.
That's why the calf muscle is called the peripheral heart, okay? In your leg, you have two systems. You have the deep venous system and the superficial system. The deep veins are the larger veins that are close to the bone that account for about 90% of the blood flow from your legs to your heart. We're going to be checking that out in a few minutes. I'll tell you about that. What I just checked on you is the most common cause of varicose veins in your left lower extremity.
Okay.
There are two major superficial veins that we look at. We look at the great saphenous vein, which is the longest vein in the body, that runs from the ankle all the way up to the groin. And the short saphenous vein runs from behind the knee to the outer ankle, okay?
Oh, okay.
Now, in your left leg, what we've already discovered is you have a very typical presentation. The portion of your great saphenous vein in the left thigh is incompetent. That means that every time you stand up, you have reflux of blood going from your heart, refluxing down through your great saphenous vein from the groin down to these branches which have bulged out and become varicose veins. So we've discovered the cause of the problem and the problem itself, and they both need to be treated. Use a technique that was developed in France called the asphalt technique, which is an acronym for removing the varicose veins in a very meticulous fashion through little needle punctures. The way I'm able to do that is I take a sterile version of this transilluminator and I image the vein on your leg and I pin it in place with an acupuncture needle while you're lying down. So when I then give you the tumescent anesthesia, the vein doesn't move. So I've completely surrounded the vein. I've exsanguinated all the blood out of the vein, and I've hydrodissected the vein along the course of the vein. So instead of dealing with a vein that looks like my pinky, which is full of blood, I'm dealing with a vein that now looks like a rubber band that's been pinned in place. So all I have to do is take a needle, I make a puncture, put a little crochet hook in, pull the vein out, and remove the vein. So this is a patient, a typical patient like you would be. She's lying down in the operating room. These are the acupuncture needles which are pinning the vein in place, and you see me injecting the tumescent anesthesia around the vein. Once a significant amount of tumescent anesthesia has been injected, it's totally anesthetized and you don't feel anything. I simply take a little needle and I make a puncture right where the acupuncture needle is. I put a little crochet hook in and I pull the vein out. You can see how small the vein is when it no longer has blood in. And basically, so all you're left with are some needle punctures, which a week or two later, basically you don't have any scars and it's healed up completely. And this is an example of what a typical patient looks like. You can see the bulging varicose veins there, and you can see a couple of weeks later, there's really no scar.
Acupuncture needles come out. You have marks there, but then they just kind of go away on their own?
Well, we do have to make a needle puncture with a small needle to get the vein out. So for a couple of weeks after the procedure, you will notice the needle puncture. It's very similar to the needle puncture you get when you have a blood test done, and it goes away within a couple of weeks. The nice thing is there's no big incisions, no stitches, and no permanent scars. I want to spend a minute on the treatment of the sclera of your spider and reticular veins in the right leg. That is done by sclerotherapy. This is a time when I think sclerotherapy is appropriate. Sclerotherapy is the injection of a detergent into these small spider veins and reticular veins. The detergents we use are either sodium sotrodecyl or polydocanol. They're both FDA approved. When we do it, we treat, as I say, you have the spider veins, which look like the branches of a tree, and the reticular vein, which looks like the trunk of the tree. You have to treat both the spider veins and the reticular veins. The spider veins are treated with a very small syringe with a tiny needle. We inject the liquid sclerosant into that, and it blanches the whole area and scars it down so they don't come back. But in order to ensure they don't come back, we also treat the feeding vessel, which is the reticular vessel. That's treated with a sclerosing agent that's a little stronger.
Well, the only question that I have is, after you have the procedure for the varicose veins, what are you allowed to do afterwards?
Okay, the procedure for the varicose veins in your left leg is going to take about an hour to an hour and a half. There's very little pain during the procedure. At the end of the procedure, we cover the puncture, the needle punctures with gauze pads, and then we put a long stocking on and ace wraps. You're able to ambulate immediately. You're in no pain whatsoever. We ask you to avoid heavy, vigorous physical activity for about a week, but you can walk normally, you can take care of your children, you can do all your normal chores. In fact, we encourage you to do as much walking as you possibly can.